It is just a huge honor for me today to be podcast interviewing Dr. James R. McAnally, DDS, FAGD, FICOI, FMII. What does all those mean? Fellow in the Academy of General Dentistry, Fellow International Congress of Oral Implantology, Fellowship in the Mish Institute. He is the founder of Big Case Marketing Dental Trust, a specialty dental advertising and sales consulting agency focusing on the advertising and sales of full arch, implant, and complex dental cases. Client members treat 1 to 2 full arch cases every week and are located throughout the United States, Canada, United Kingdom, and Australia. Big Case Full Arch program constitutes the largest network of independent implant practices, advertising and focusing on one-day treatment modalities for the full arch implant case patient. Big Case Medicare Money Program is the largest advertising, billing, coding, and reimbursement network of implantologists accessing up to $23,000 in Medicare Original Part B medical necessary benefits for the oral surgery patient. He and his consulting team have been helping generalists, implantologists, and specialists with advanced surgery and restorative skills find and gain case acceptance on major implant cases for more than a decade. He personally been involved with clinical dentistry for 29 years, named a global leader in dental consulting for 10 consecutive years, and author of multiple books on advertising and sales processes in dentistry for complex case dental patients. His e-letter reaches more than 150,000 dentists worldwide each month. And I'm so honored today that you came on the show. I asked you to come on the show. You didn't ask me. And the reason I brought you on the show is because every dentist I know will tell you they hate selling dentistry. So you went into a job where all your customers stop you at the door and say, "Hey, James, I hate this. Continue."
Yeah.
How do you change their mindset, or how do you do it?
Well, the reality is for these guys that have this kind of training, they either have to get serious about sales or they really aren't going to do any cases, Howard. Even for these guys that are getting this sort of subsidy from the Medicare system to help sell their cases, there's still a huge amount of money that the patient has to pay out of pocket. And so when you look at these practices that do 100 cases a year, they've gotten serious about sales. And of course advertising, because those two things go hand in hand to create those cases. And the guys who are sitting around going, "Oh, I wish I could do more of those cases," are the ones that they don't take that part seriously, either personally or they don't delegate that to their, to a salesperson internally in the practice. Clear Choice is a great example of this, which is a national entity in the U.S. that sells a ton of dental implants. And if you walk into their office, they are serious about sales process. They're going to do some things differently than what I teach as far as putting pressure on patients, which I don't like, but they're doing a lot of implants because they're serious about sales. And so my clients get serious about sales as well to do that many cases.
By the way, you mentioned Clear Choice. We had the founder, oral surgeon, on show 375, Impeccable Implants with Old Jensen. But it's amazing because when I look at data in America, the average new car price in America is $33,560, according to Kelley Blue Book and USA Today. And on average, Americans will buy 13 new cars by age 76 years old. Source Anthony Pratt, Polk Director of Forecasting. And so when you look at the 211,000 Americans who have an active license to practice dentistry today, 95% of them will never do one case that their patient base will spend on a new car. So why does a dentist, even if he's in rural America and he says these farmers don't have any money, and then you go to the grocery store and everybody's driving a $40,000 F-150 or a $60,000 F-250. I remember I was in Beeville, Texas, and my daughter-in-law saw an F-350 truck for $98,000. And when she saw it, she went, oh my God, that's the most beautiful truck. So why is it in Beeville, Texas, that people will spend $40,000, $60,000, or $100,000 on a Ford truck? And then that the dentist that treats them thinks, well, they'll never spend that on their mouth.
Oh, Howard, that's all a mindset thing, because you go into any of these parts of the country, and unless everyone's living under a bridge, which is not the case, you're going to find people spending as much on their truck or more, as you've already pointed out, than they spend on their teeth. And most of that is the dentist just not telling them what the options are, and of course not advertising to the public about most of these services. So it's usually a dentist mindset problem. It's not a problem with the customer. So those people are buying those crazy trucks or whatever it is. It's not just trucks, it's all kinds of stuff that cost just as much as a mouthful of dentistry.
And I certainly wouldn't want to go to a doctor that didn't give me all my options. I mean, I saw this deal on HBO where Cuba is the lead country on lung cancer. And patients, the United States is running about a 5% 5-year survival rate, and Cuba's at a 25%. And the doctors, very few doctors saying, by the way, would you think about just flying to Havana? I mean, I would leave the U.S. healthcare system in a minute if I thought I had a 5 times greater success rate in Cuba. And when Clear Choice came in, there's 2 types of dentists: those that always live in fear and scarcity and the sky's falling, and then those that think in hope, growth, and abundance. And I remember when Clear Choice came to Phoenix, Arizona, half of the special like, oh my God, they're gonna steal all of our business, and the other half is like, my God, they're on TV all day, every day. Now I'm having my routine patients say to me, have you seen those commercials? Can you do that? And it's like, my gosh, I was looking at Clear Choice like a rising tide lifts all boats, and any of my homies that want to come into the Phoenix market and do $1 million a year in television advertising is my new best friend.
Exactly. You used to have this debate, we'd always hammer on the ADA. Let's have a national advertising plan for dentistry, blah, blah, blah. Well, these guys have done a far better job of implant awareness than anything we've done as a profession. So in these markets where you have them advertising like this, everybody does more cases. It's beautiful. If you got them in your market, you need to be running after the implant cases too, because they're generating business for everybody. They really are.
It was me, Gordon Christian, Rich Maddow of the Maddow Report, and oh my gosh, Woody Oakes, the professional dentist, all went to the American Dental Association. We all met down there with the president and all their people, telling them about this need for a national advertising campaign. And you know what they did? They said, okay. So they put together a committee. They put together a budget. The periodontists 3 years later could not agree on the script of a 60-second commercial. And the ADA people, they don't want to, the executive director doesn't want to call out, their homies, but they're like, these guys could never agree on what a commercial should say. Whereas free enterprise, how long do you think it takes Clear Choice to go from writing, scripting, filming a commercial?
A week, max.
Yeah. So
I remember that when it came through the ADA, and it was like, where did this go? So, and by the way, Howard, so you speak of the specialists like that, a lot of them are even figuring out now that they have to play the game differently if they want to do these cases. So like, this is kind of like a little secret inside the profession that most of the specialists are not doing these full arch cases. That's not the dentists who do these cases, because of the complexity of selling. You've got the oral surgeon, the periodontist trying to sell it, and the restoring person. So when you get this sort of like multiple players, the patient's confused and they don't buy. But yet now you have more surgeons and periodontists who are saying, maybe we should be restoring these, whether it's self, which some of them are doing, or they're bringing someone in-house. And they're the ones who've finally gotten smart about this. So it's kind of funny that we're at that place from the advertising at this point.
So are most of your clients in implantologists that place and restore the implant? Is that who's doing the majority of all in four?
Yeah, the majority of these cases, besides Clear Choice, besides a few big players in the specialties, they are implantologists who do the cases for the most part. So the patient's going to come in. Everything that they need to have done is going to be in that facility. Nobel calls these people total solution providers, essentially. So you walk in, diagnosis, everything's planned there. It's simpler that way. You have less confusion, and the patient's more willing to write that check for something that, actually, Howard, now these cases are down to less than the average price of a car. So they're not even having to write the check for as much as a car anymore. So, but that's typically who's doing the most cases.
And we see that total solution provider, that was the retail business model for 300 years of economic research. Like you go back 300 years, the stories were, the store was downstairs and mom and dad lived upstairs. And then the next generation would bankrupt them by building a store 2,000 feet. The next generation go 4,000 feet, then 8,000, then 16. And they got all the way up to 250,000 square foot Walmarts, Ikeas, Home Depots, the whole 9 yards. But now when you look at pediatric dentists and orthodontists, No one wants to go to a pediatric dentist there and hear, her bite looks funny. I'm going to send you down the street, make another appointment with an orthodontist a week from now. And these orthodontists and pediatric dentists are teaming up. And the mom's like, one-stop shop is everything. So you just called them total solution providers. If I needed to have a surgery, I don't want to go to two places if I can go to one. I mean, that I don't think anybody's going to change that retail model. And now that the Texas Supreme Court case said that that a specialist is anyone who specializes in that. It's not determined by the nonprofit American Dental Association membership club. That's not a government agency. The courts are saying that, man, if that's all you do is implants and you specialize, you're an implantologist, well, that's true. So is that changing the marketing, or are they calling themselves implantologists?
Yeah. In these states that are covered by that court ruling, I know certainly for our clients, we are heavily saying advertise as a specialist. Now, is that going to be the only determining factor in what causes people to buy? No, but in a market where you have multiple players, which is typical these days, you're usually going to have at least several people in a market that are really focusing on these cases. So it winds up being a bit of a differentiator. So like Southwest Florida, my epicenter of our strength is in the Southeast.
Are you mostly doing all on four, or is it just implantology in general, your clients?
Well, so here this kind of goes back to the total solution provider. And, Amazon has changed the reality for all of us. I'm sure, Howard, you're probably an Amazon user, yeah?
Yeah, Amazon Prime.
Exactly. So you have Prime that has these hundreds of millions of customers around, now it's global. We got this Prime business all over the world that's changing the thought of how fast stuff should get to you. And so for the implant patient, especially someone who's in the terminal dentition, which is, 45 plus years old, they're babysitting this mouthful of diseased teeth, they don't want a denture, they want something that's going to happen fast. And so the reality is that the message that creates that phone call from that patient revolves around speed. So that is really it, whether it's all in 4, all in 6, whatever the same day method is to treat this patient, that's what the market wants. For all the messaging out there, that's because if I can get it fast, I'm all for it. So then, your traditional implant case, it takes 6-9 months. That's people don't want to buy that anymore.
So what I love, what I love most about Amazon is that his wife, Mackenzie, is single now, and she's got $75 billion. If I sent you my resume, is there any way you can send it to her? I'm trying to get my alimony money back, and that's my best idea. On these total solutions, what percent of these cases does the implantologist do the IV sedation versus bringing in an anesthesiologist?
Let's be real. There's a lot of politics around sedation dentistry. If you follow this closely at all, the oral. We're just going to call it like it is. The oral surgeons hate the fact that general dentists do sedation dentistry, and so in almost every state where you have these bitter, angry oral surgeons, they start attacking the generalists and trying to change the rules around sedation. So depending on the state, you have some states where you're allowed to do deep sedation in your office, other states where you have to have practically a hospital facility in order to have anesthesia services. So it's kind of all over the map. And of course, from the patient's perspective, the better we can be at sedation, the better this case is going to be for them. So I always encourage our doctors to either be, IV sedation credentialed, and if they can't do that, and because of their state laws, then we need to bring in an anesthetist if you want to do a lot of cases. Because patient comfort's a big deal when you're doing surgery. I mean, that's the reality that we're also selling with this amount of money on the table.
My oral surgeon has an anesthesiologist for the last 20 years just because he just says it's like a hygienist. He doesn't want to do his clean. He's just faster. He does more production just walking in the room, and it's all set up and ready to go. He just goes from room to room and does the surgery and consultations. So do you think practice management wise, it's faster, easier, higher quality, more net income to have an anesthesiologist?
If you're really serious about, like, let's say you're going to go this game where you're going to do 100 of these cases a year, you're silly if you don't have that individual in there because your stress level is going to be so much lower. Speed's going to be better. You can build this into your fees because, again, if you do good sales process, you're going to get paid and compensated well for these cases because they still are highly profitable. And hopefully you live in a part of the country where you've got availability of these anesthetists that will come to the office. And, you find a good anesthetist and you can keep them busy just as, you as the main guy, if you're doing a lot of cases.
The only people that have been able to show me data, actual studies done by PhDs and universities, it's always consistently shown for 30 years that the American market is just basically two markets. One buys on price and one buys on fear. What percent of, what do you think is the bigger barrier to entry to getting an all on four? Is it the price or the fear?
I would say it leans slightly towards price, Howard. Again, because we've been so poor at sales in general in the profession, have patients, they really have no clue on why this stuff costs as much as it does, or that it's going to cost as much as it does. There's still, you're still treating each patient individually. You can't treat three people at the same time. So there's a limit to how efficient you can make this process. So the price of it, we're really getting down to where unless something really spectacular happens on the laboratory side or the component side, we're kind of getting down to where you can't really cut costs anymore for this procedure to be profitable for us. So you're still going to have a percent of the market. They'll go out and they're going to spend $50K on that Forward F350, but they're going to balk at spending $20K on the arch of dentistry no matter what. So that's a reality we have to deal with. And on the advertising side, you just have to create more prospects to deal with it because it is a numbers game. If we want to do, if we want to do 2 cases a month, on average, you need to have 30 phone calls coming to a practice each month to get those 2 cases.
So it's 15 to 1, so 15 consultations or 15 incoming calls?
15 incoming calls, so quality calls, people coming from very specific advertising revolving around this procedure.
And that procedure being all on 4 or just a big implant case?
A big implant case. But typically, if you're in a market where multiple players are advertising, if you have anyone else advertising same-day treatment, you're going to have to, because otherwise that person's going to be the one cleaning up.
And do you
when I say same-day treatment, so that's all in 4, all in 6, whatever, teeth today, whatever you want to call your particular version of this.
Yeah, so the funnel is 15 incoming calls from marketing to get 1 qualified paying customer.
Oh, right. And you're going to pick up some other types, that maybe some single teeth, that kind of stuff. But to get a full arch, that's pretty much the ratio we're looking at.
So your website is the McAnally. It's McAnally, but it's spelled THEMCANALLY sellingsystem.com. The McAnally sellingsystem.com. What are my homies going to find if they go to the McAnally sellingsystem.com?
Well, and also bigcasemarketing.com points to all of that. So that's really what we advertise. It's a forwarding address. Basically, they're to find information about what we do primarily, which is helping doctors advertise for full arch cases, because we do serve as an advertising agency for these docs.
Okay, but I got to stop you there, because I always knew you as Big Case Marketing. But if you go to bigcasemarketing.com right now, it immediately forwards to the McAnally selling system.
Yeah, exactly.
Okay.
Yeah. And so if they go to that site, they're going to find information about what we do, full arch advertising. And we're actually, as always, people are rebuilding their sites. We're in the process of that right now, because we need to have more information up about how Medicare can play a role in these cases as well. So we don't really have much on the site about that right now. But docs that are just barely interested in this topic, they can come and just put their email in, and they'll start getting, emails from us to educate them on what we do. While most practices, if they're even interested in selling a $10,000 or larger case all the time, they really need to be serious about sales. And so that's also part of our consultancy, which is just purely sales training as well. The ones who take that seriously, they get to have more fun with their CE, because they go back and sell cases. That's the reality of it.
So I know my dentist. I love him to death. I've known him forever, 30 years plus dental school. It's the mindset. They just tell you right up front. It's like I can't tell you all the advantages of going to LA with me this week. And if you're in Phoenix saying, I don't want to leave Phoenix, I don't want to fight the traffic, I don't want to go to LA. So how do you change their mindset? Would you recommend, talk about your book, The Dentist Unfair Advantage, the 39 key tenets for practice success, with a bunch of 5-star reviews on Amazon. Would that be a place to start?
You know, Howard, actually the book is out of print, and I'm not going to put it back into print for a few reasons. And here's the deal. You know, people buy this kind of thing and then they put it on the shelf and they keep saying, oh, I need to read that damn book before I actually get any help about my practice. And then 5 years later, they still haven't read the book. You know, so now it's like if you're a customer of ours or a client, we'll hand out the book to you. But generally now it's just better for people to get free information at the site and educate themselves that way. Because typically, it's the old saying, it's like once the students are ready, the teacher appears, right?
Right.
You know, so that's kind of how our customer shows up. It's either someone who's, you know, they finally got the bug for implants and they want to finally do a lot of cases, or they said, you know, I'm sick of hearing no when I try to sell my cases and I want to have help with that. So that's how they show up at our doorstep.
Yeah, what I always liked about you and I both have our fellowship in the missions too. We both have our I have my diplomat in the International College of Implantology, but I'm old school. So before I went to Mish, I bought his book. It was the #1 selling book in dentistry of all time. And I read the entire book. And now, and you know, you go to these courses and these dentists will go to a course and they'll drop like $3,500 for the weekend. And it's like, and they're asking questions that are like, dude, that was in the first chapter of the book. Why are they, they just, it's almost like it's an ego thing. Like, well, if I spend $3,500 every weekend at Coyce or Ross Nash or Spear or Pankey, well, then I'll be smart, right? You can just buy smart. And I'm like, dude, if you just buy the $179 textbook and read it. And then when I was doing those courses, it was a, all the way from Phoenix to Pittsburgh, which is a 5-hour flight each way. And I would just reread the book. I would reread the book going back and forth until, same thing with Pathways to the Pulp by Stephen Cohen. I mean, these dentists ask endo questions and it's like, dude, you've been practicing, you spent $400,000 in dental school. You've been practicing 5 years and you're saying something you're asking a question that's in chapter 3 of the #1 selling endodontic book of all time. Just read. And then if you can't read, I don't know how you became a doctor if you can't read. A lot of those are audiobooks now.
Yeah, most people, you know, it's a mindset thing, Howard. Generationally, it's changed immensely with how people will get information and use it. That Mish book, if you were relegated to some horrible part of the world where there was no CE, you could read that book and do the procedures. I mean, he spelled it out step by step. So that book could take you, I mean, you could do a sinus lift by reading the damn book. But that's not the mindset now. And it's a different beast out there. So here's the thing for the people listening that are willing to go be a student again. They have an automatic advantage because everyone else is lazy, basically. So if you're willing to devote some of that time to being a good student again, you're going to clean up. So that's my advice to young folks listening to this.
Yeah, and I think that an enterprising, resourceful, intelligent person would never do anything for $10 if they could do it for $1. And I mean, just read, maybe, and you just set a time. Maybe it's just an hour a day. You know, if it's just an hour a day, I remember one of the guys who wrote the most novels was on an interview one time. They said, well, how do you keep writing all these successful novels? And he says, because I get up every morning and I just write for 1 hour every day. But you do that, well, 8, 9, 10 months later, you got another smash novel. So they just need to get if you want to change something big, you got to change something small every day. And adding reading dental knowledge instead of staying up with the Kardashians would be a great idea.
Yeah, we all have to work. I mean, I still write tons, Howard, because that's how I sell, you know, to people who are interested in that. So I have to write to put the message out there. You know, and Stephen King had a book out where he talks about how he writes, and you hit it on the head with he sets aside time every day in the morning. He grinds it out, no matter how he feels. You know, and that's the nature of productivity. You know, it's not watching the Kardashians; it's doing on a daily basis.
Yeah, I agree. I'm committed to diabetes and obesity. So every morning I get up, the first thing I do is I overeat for an hour. And that's how I'm able to stay committed. So talk about your system though. So they're listening to you, and I know what she's saying. She's saying, I didn't go to 8 years of college to sell dentistry, but man, I would really like to restore some of these cases. And if the average American is buying 13 cars in their lifetime for $33,000 $560 a piece. And then some of the podcasts I've done, I mean, when I find these offices doing 3 to 5 million, I mean, there's Bill Weathers in some town, nothing town in Georgia that's been doing 10,000 a day his whole life. There's Bruce Beard in a small nothing town in, I think it's a one stoplight town in, I don't even remember the city it's in Texas. Same thing, you know, he does like 4 million a year in just some Ford 150 town. So how do the, you know, and then the people listening to you, you know, they're, how can you sell, what is your program? If they go to the, well, I do like big case marketing. I see what you're doing there because it's a lot easier to remember bigcasemarketing.com and then have that forward link you to the McAnally selling system. But if they go to bigcasemarketing.com, what are they going to find and what is their action to learn how to sell these big cases?
Well, you know, for the folks that are serious about saying, look, let's start putting some numbers on things, Howard. You know, let's say someone is going to go to a COIS course, or they're going to go back to MISH, which will exist. You know, the dollar signs that they're going to commit to that kind of education. What do you think, Howard? By the time someone would complete COIS?
Oh, I mean, my God, I spent 6 weeks at the Pankey Institute. I think by the time you pay that $4,000 a week, and then how much production do you lose by not seeing patients that week? And then there's the airfare, the hotel, and of course my 4 boys always wanted to go with me to all those trips because they wanted to sit on that beach on Key Biscayne, Florida, and play in the ocean while I was in there. I mean, it's just, I mean, how would you measure? Would you talk about tuition, travel, family, misproduction? I mean, I probably spent $250,000 at the Pankey Institute.
Exactly. So at minimum, it's 100 G's, no matter what. I mean, no matter how we slice this thing. So someone that walks in our door, and if they're willing to spend $12,000, we're going to hand them the skills to sell a $25,000, $50,000 case. You know, before they run off to spend that kind of money on their training, or if they're in the middle of it, they need to be able to actually be selling this stuff back in their practice. So that's kind of a bare minimum. If someone's not willing to do that kind of stuff with us, they don't deserve to do those cases, because, you know, that's just the price of admission to sales. Now, if it's an implantologist type person, we're going to have a different path where we do research in their market, look at what the advertising costs are, to see really what's viable for them to be a player in the market if they really want to do a lot of these cases. So that's kind of the other camp, is the implantology practice that wants to have help with the advertising and the sales of those cases. So that's really kind of the two sort of pathways someone might take when they show up at our doorstep. Because, you know, the reality is most of your folks listening to this, you know, they're either going to be doing ortho or Invisalign or, you know, all kinds of dentate procedures that still cost more than a cheap car, you know, the cheapest cars. And so for every one of those people, if they're willing to get better at sales or to delegate that, and be serious about delegation, by the way, it's not like delegating it, not backing the person up in the practice, it's going to be the salesperson. But if they're willing to do those kinds of things, they're going to open a door to finally putting those skills to work. And of course, if they're the implantologist, then we're going to be getting serious about how many of these cases do you want to do in a year. And by and large, most of our clients want to do at least 3 cases a month at minimum. You know, 36 cases a year, you know, the $25,000 to $30,000 a case. And then of course, some people really want to be a big player, like becoming a Golpa in Nevada, or becoming as big as Clear Choice in their market. And that's, of course, another level of the game as well when they're going after these cases.
And again, I just want to say over and over and over that I think one of the mental barriers that dentists have is they think the only people that have money live in Beverly Hills and Key Biscayne and Manhattan. And I always tell them, would you rather own Ruth Chris Steakhouse or would you rather own McDonald's? And in my lifetime, when I was going down to the Mission Institute, I mean, this is 3 decades ago, and now 3 decades later, I looked at, well, who did I go through my class with that got my fellowship at Mission Institute that just came out of there and went from a $750,000 practice to a $2 to $5 million practice? You know what the one strategy it always was? They would go back to some poor town like Bakersfield, and there was this dental world there, and they could go pick up Dental World for $400,000 or $500,000. I had a brand name for 30 years, and they keep the denturist, but then on the consultation, they would come in for their $275 denture or $499 full mouth. or they'd start with the upgrade to nicer teeth from Ivoclar, so that'd be up to $750. And then if they were in Australia, 1 implant down the middle. If they're Americans, 2 implants, and then they upgrade some to all on 4. And they would go into this place and they'd say, yeah, when 100 people come in to get their reline from a trailer park, like they've been doing for 3 decades, we're upgrading 20% of these people to 1, 2, or 4 implants. And I mean, it's not the economy. I mean, you live in the United States, Canada, Australia, New Zealand, England, Hong Kong. It's not your economy. You don't live in the Congo. You don't live in Tanzania. You live in a very rich country, and these people pay bank. And what the other thing I don't understand is like Dr. Richard Litt is a board certified orthodontist who is the orthodontic instructor at UCSFF, and he was been in Detroit, Michigan for a decade or 2. He teaches this course for orthodontics, and it's 4 3-day weekends for $5,000, and everybody balks at the price. It's like, well, what is your first ortho case going to be? $5,000, $6,500, and on your website, you there's a testimonial by a dentist I know who sits there and says, I did my first case presentation following your precepts, and a clerk from a local nursery agreed to a $65,000 rehab. So your course is it's $12,500. Is that, you said? What was the actual fee? Is it a contract? Is it
well, so like that, Howard? Let's say if someone comes in and they want to do sales training, it could be as little as 3 months, or they could be really slow and do it over 6 months. But so they're going to invest anywhere from 6 to 12 G's to do sales training. I mean, that's the bottom line with our fees. If they're going on into where we serve as an advertising agency, looking to do 3 cases a month, then you're looking at about $36,000 in an annual consulting cost for that. So price of admission. If you want to do those big cases all the time, you got to have expertise help, and that's kind of what people are paying for.
You're teaching them. So you're a one-stop shop. So you're doing the marketing to get them 15 qualified calls to get 1 case closed. And I also say what I love the most about your website is you talk so much about the answering the damn phone. I mean, last piece of data I saw where you actually had real data by real people who measured it showed that 39% of dental office phone calls go to voicemail. And at the end of the day, you sit there and say, hey, how's your receptionist, Valerie? Oh, she's the greatest.
Awesome.
Did you know that 4 out of 10 of her calls went to voicemail, and they're back there doing a molar root? When I do a molar root canal, I lose all concept of time and space for an hour. I mean, you look at the clock, it's 9, and you finally are done. You look up and it's like 10. And it's like, so you don't know what the phones are doing up front. So let's talk about the marketing. So part of your program, you'll actually do the marketing. And what kind of marketing are you doing? Is it direct mail? Is it Google AdWords? Is it Facebook? What's your advertising plan?
Harry, can I back up to where you talked about people in the economy for just a second?
Yeah.
The reality is if you live in these more what I call secondary markets that are outside the metro core, you actually have an advantage because there's usually fewer dentists advertising for these services.
Would you call that the rural market? You're calling it a secondary market? Is that? Would you also call that rural?
I wouldn't call it rural. This is the Rochester, New York.
Okay.
This is the Bakersfield, California. It's the Waterbury, Connecticut, and you go into these markets, and these are kind of what I call average Americans, right? And you do gangbuster business in these places because you don't have a lot of competition and not a lot of advertising. You go into like Beverly Hills, California, where you have this perception of all the money, blah, 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 and actually it's more brutal. It's more difficult to do the cases in those markets. So that's a mindset thing that dentists need to get over, because if you live in those secondary markets, it's kind of like you're there on the track and there's nobody else going to run with you. So you might as well start. So anyway, that's the thing about the economy. Now, as far as advertising, the reality is that a lot of advertising now is search-based. There's almost no market in the world where we don't utilize some search-based advertising, meaning that the patient types things into Google, and certain phrases and certain keywords definitely are pointing towards this patient who is usually in a terminal dentition. That's who we're looking for. I think it's important that everyone understand that, because everyone thinks dental implants is about the edentulous. Well, most people now who really need implants they're somewhere in between those two things. They're either babysitting a full mouth of diseased teeth, or they've got some missing teeth, some remaining teeth. So the terminal dentition patient is who is the prime target these days. So search-based advertising, most of these markets, if they have a paid subscription newspaper, that's still a very viable way of finding this patient, because again, the older patient is going to be reading the newspaper. It might be direct mail, it might be television. A lot of this is market-based, so you need someone researching what the avenues really are for that location. And because a lot of our clients are soloists, there's also going to be, they can't be like a Clear Choice. You're not going to be able to match that kind of advertising dollars. So there's also going to be a limit on where we put the money and how you have to be efficient. Now, as a starting point for the advertising costs in almost every market in the U.S., it's hard to go below $2,000, $2,500, $3,000 a month to play this game of going after a full arch implant case. That's sort of the price of admission to get the phone calls coming. Does that make sense?
Yes.
Yeah. And if you're in a market that's super competitive, then you're going to need something else that's special about your situation or what you go to the public with. And what that special thing is for a lot of our clients is that we actually help doctors go into the 65 plus population, patients who have what's called original Medicare Part B, and pick up some surgical benefits from that insurance system that can help offset the cost of comprehensive treatment. So that's kind of one of the other things happening right now in this particular niche in dentistry is those patients that have that particular policy, they're very interested in those benefits if they can get them.
Yeah, and another thing that you got to realize is that when you go to Beverly Hills and Scottsdale, those big old homes on half-acre lots, and then you figure in streets and roadways and access and all that, you might only have 5-6 people living on an acre. But when you go into Phoenix or Los Angeles, it's 10 times that much. And a lot of the data shows that dentists, that patients prefer to drive to a dentist within 20 minutes of their house. And so when you go to Bakersfield, who Johnny Carson called the armpit of California, there's just so many people. Whereas you go to, and hardly any providers. And then you go to Beverly Hills, and everybody goes there because they're attracted to all the lifestyles of the rich and famous. And it's would you rather be a dentist in Beverly Hills or Bakersfield?
Hands down, Bakersfield.
Yeah, and my buddies,
I'll take it one step further, Howard. You probably have heard of this company called Del Webb, correct?
Right.
They're one of the biggest home builders in the country, and if you look at what they pay attention to, is they're going after the 55-plus-year-old, what they call active adults, and they're building these lifestyle communities for this population. And these people have the money and the need. So if I was a dentist now, I would be like getting my butt close to a Del Webb community, because that's, it's sort of like the trifecta of what we're up to with dentists.
Right. And when you're 40, I mean, we just had a bunch of snow in Arizona a couple weeks ago, and everybody that was under 40 or 35 was heading north to go ski. Well, grandma doesn't want to go ski. Her favorite hobby is going to lunch and dinner and breakfast. And when she has the family over, it's all about eating and meals. And if she is not enjoying her eating and her meals because of her teeth, she will pay for what it costs to get a new car to be able to chew. And if you don't believe it, then what is Clear Choice a figment of my imagination? I mean, do you really think?
Yeah, Clear Choice will help her out. Yeah.
Right. So I want to switch gears completely and go to the phones, because that's been one of my pet peeves forever. I mean, I always tell people, I mean, the business you're in, I have so much respect for you, because you're going into a business where every dentist will tell you they hate sales. So what did James McAnally decide to do? Get into teaching dentists how to do sales. The second thing they don't do is they don't answer their phone. And there's 168 hours in a week, and they to be a dentist, 8 to 12 years of college, a hygienist, 4 years of college. All my assistants went to a year of Phoenix College, and then they hire a receptionist off the street, no training. They don't have any software on their telephone. They can't tell me how many incoming calls came in last month. They can't tell me how many outgoing sales calls they had last month. I mean, it's just like, so talk about your beliefs in the phone system, and
absolutely.
how does your program help them with the phone?
Well, and you've hit the nail on the head. 39% is pretty much on target, Howard. That's what I see when I look into clients' call measurements, because we mandatorily track and record everything that comes through our advertising, because you sort of have three things going on with the full arch case. You've got advertising, generating the phone call. Then you've got the phone call ringing, which you've already figured out is a huge problem in most practices. And then you have the sales process on the other side of the phone call. And anything goes wrong in these three aspects, we don't do the cases. And so you already identified one of the first barriers is phone sales, because that's what it is. You're selling consultations. And the fact that most people give away a free consultation and they can't even sell that, I'm giving it away for free, but I can't even sell it, it's sad, because now we're screwing the patients over. But basically, realizing that this is so important, every single advertising client we have, we push them through intensive phone training. And every month, provide reports on how many calls are coming. If they're not doing cases from the calls, we always investigate what's being said on the phone, because typically that's where the problem is. And where most dentists make their number one mistake with phone is they try to hire people who have dental industry experience. They want someone answering the phone, oh great, you have dental experience. Well, usually that experience brings over all kinds of bad habits that really don't help us as a practitioner. So I'm all for, let's find someone who has zero dental experience, and we train them to be great at phone sales, or they come in from a sales background, because that's going to be our real winner when we're spending this kind of dough on creating the phone calls. But most dentists, they refuse to record anything. They don't want to. It's kind of like this whole thing of putting their hands over their eyes, like, oh, I don't know what's going on up there, but boy, I'm opposed to investigating too much, because then I might have to do something. And then you have the guy who starts listening to the calls and finds out the staff is doing a horrible job, and then he's afraid of replacing them. And that's kind of one of your other ahas as an adult, is every one of us is replaceable. For sure. Me doing this specialty job, I'm replaceable. You're replaceable, Howard. Everybody is. And so those staff that are doing a horrible job, we give them the tools to get better, and if they don't get better, we replace them. I mean, that's the reality of what you have to do if you're spending this kind of dough on the advertising.
Actually, when you say everyone's replaceable, actually that's not true, because when I quit dancing at Chippendales, they actually had to close. They could not replace me. You said there were three parts: the incoming phone call. What were the three parts? Incoming phone call. Incoming.
So let's talk about any. This doesn't matter whether it's implants or orthodontics or whatever. You've got to create phone calls somehow. So you've got advertising, or you've got referrals or whatever that's creating that part of your sales process. So you get the train rolling, you got to have calls coming. And the millennials will also hate that concept. They don't want to talk on the phone. But the reality is that's still how most of our business is really done for these large cases. It's one-to-one on the phone to get someone convinced that we're the right practitioner for them. You have a stranger calling the office, and we got to convince them that we're the person for them. So you have the calls coming from advertising. Then you have phone sales when the phone call arrives at the office, and if it's picked up live, which is best. If it drops the voicemail, forget it. That patient, if they don't know you, they're probably not going to call back. They're going to keep looking. If it's answered and then answered poorly, and that happens a lot, then also we lose the customer. So you have to have a good phone sales process. And the part about this is not super sexy, Howard. It's not sexy to be training phone skills, but yet that's what's required when that call arrives, is that someone is trained to take it properly, converts it to a consultation. Then we move on to face-to-face sales, which is another aspect of this. When you're trying to take a check that's $10, $20, $30, $40, $50,000 from a patient.
And you call that FaceTime sales?
Yeah, face-to-face.
Face-to-face sales.
Yeah, face-to-face in the office. You got to deal with that, whether you delegate that all to like a professional salesperson in the practice. And by the way, in Clear Choice, the doctors don't sell. They've removed them from the equation. They have hardcore sales team, not the doctor. The patient
So you
barely
you
even meets the
develop a
doctor.
treatment plan presenter to do the sales, not the doctor?
At the end of the day, Howard, we're going to get a better fee, bigger fee, better case acceptance if the guy who takes the check at least presents the top line number to the patient. If the doctor will look that patient in the eye and say, for your situation, it's going to cost $35,450 to do this treatment, and then letting the staff do the financial arrangements. That's the ultimate winner, because the patient trusts who's going to do the surgery. But if the doctor can't be confident at that, we've got to train someone else in the office who will do that. And that's the other end of it. We also have clients who, they've realized that that's never going to be their forte. So let's get someone else in the office who will sell the cases. So that's, both situations. Some dentists who they man up and they woman up and they're the salesperson, and you have others that say, I'm gonna present the case, but all of the financials are going to be someone else that we train.
Yeah, and I wrote a column one time, just wrote a lot of people say, well, that's not me. Well, I mean, look at the greatest actors in the world. I mean, they're on Hollywood. When you pull up to your office and you say, well, I'm not really a leader. Well, quit telling yourself that. Tell yourself you're the best leader. And then when you sit there and say, well, I don't want to present the fee, just start telling yourself that you want to present the fee. Because if I was going to go in and I had some disease, say I had cancer, I wouldn't want the oncologist to not just look me in the eye and say, you need surgery and radiation and I want to start today. I don't want him to say, well, and the other thing about recording phone calls, I mean, when they started putting video cameras above cash registers at all the 7-Elevens and Circle Ks, internal peculation embezzlement dropped to almost zero. And everybody they're humans. And when you're recording the phone call and somebody is going to listen, you answer the phone completely different when your dentist is dreaming and looking for a fourth canal and has no idea that you're talking to your Aunt Shirley for 15 minutes on the phone.
Here's one of the other insights into what you just said about the recording. And this goes for the phone, as well as like recording of the sales presentation, the case presentation in the office. When people start committing to that and recording, their results usually improve across the board, ironically, just because they're measuring and they think more about what they're going to say and like, oh, I got to get serious about this because, we're gonna have that transcribed and we're going to look at it, or James is going to look at it back wherever he is this week and kind of give me a grade on this thing. So that one thing will also change what happens in a practice just by being serious about recording.
And another thing you said about dental experience, I mean, my gosh, I remember the first time I'd always, when my dad was going golf when I was a little kid, I always wanted to go with him, and he said, no, he's busy and this and that. When he finally took me, I was so excited. I don't know how old I was, 10 or something. And when we got to the golf course, that's when he told me that, well, you're not golfing with me. You've never golfed before. You're going to come and you're going to take 10 lessons with this deal, because you go out there and develop a bad hook, you're never going to get rid of it. You need to learn how to golf right from the beginning. And, when these people come in, they say, well, I have 10 years experience. Really? Why are you leaving your last office? Oh, he hung himself, and then you look at your own staff and it's like, you don't record their calls. You don't have any big cases. What I see is there's 5% of dentists that work Monday through Thursday, 8 to 5. And then they go in every Friday, and that's when they do their big case. And the anesthesiologist meets the patient. Sometimes they just like, oh my God, James McAnally's here, and he needs 4 molar root canals. I can't do 4 molar. So they'll have an endodontist come in, and then they'll pay them 50%, but it's really not 50% because the insurance company might only give you $700 for a root canal. But the same insurance company will pay an endodontist $1,200 for a molar. Some of them are $1,500. So they'll just come in there and greet the patient. The anesthesiologist puts them in. A endodontist might come in and do a couple of root canals, and then when he's done, a periodontist goes in there and places 4 or 5 implants. But they do a big case like that every Friday, 50 times a year. And then you go in that medical dental building where there's 8 other dentists, and the other 7 dentists will never do it one time in their entire career. Will they ever do one big case the price of the median average new car? So how do you fix that?
Yeah, I lecture. It's something switches in some of these dentists, Howard. Like the high performer, a lady dentist in Waterbury, Connecticut. 3 years ago, she'd never done an implant case, and now, she has an associate, and I'm going to come back to that topic in just a second. But now she basically is only doing implant cases. Something in her mind said that's what I'm going to do. And that's, I don't know what that switch is in that type of dentist, but it does happen. And then you've got the other folks, just like you said, they're sitting on their hands in the medical dental building, and they've never done a big case. I just did a lecture at the Sklar Center in Miami. It's one of the better all-in-floor training programs in the country. And I'll ask in the room, how many people have done a $50,000 case? And you've got these people there that are about to take this surgical training where if someone comes in to do 2 arches, it's pretty much going to be 50 G's. And yet you'll have a room full of people, they've never done a $50,000 case in their life. And yet here they are paying to get these skills where that's what you're selling. But basically what I see is sort of the winning formula right now, Howard, with what we're doing on the implant side. It's usually one implantologist with an associate. Because once they start going after these large cases, and all the general dentistry just flows over to the associate. And so that's the model right now that seems to be working the best, because usually if you're a soloist and you don't have an associate, you're going to get into this whole tug of war with the general dentistry and your specialty services. And not a lot of folks can really navigate that as just a soloist without the associate there.
And I'm going to go back to that we started the show about the retail model, about, the most successful pediatric dentistry formula is to bring in an orthodontist for one-stop shop. You're talking about one-stop shop, place the implant, do the sedation, restore the teeth. And that one-stop shop, if I was graduating from school, these guys come out of these private schools are paying $100,000 a year. So when they come out of private schools, they got $400,000 student loans, and then they usually get married and then go to endo school or perio school for 3 more years. And we saw that one orthodontist in Las Vegas who graduated an orthodontist with $1 million in debt. And then what do they want to do? They want to go buy a land.
Hold on, Howard. That's a winning number.
1 million?
$1 million debt.
Yeah, it was all over Dental Town. But then he wants to go buy land, building, and get another $1 million in debt. And if I came out of endo school or perio school and I was coming to Phoenix, Arizona, why wouldn't you just pick the 5 biggest practices in Phoenix? You have no overhead. A lot of them negotiate 50% of their income fee, and they just do all the molar endo. I just think at the end of the day, the consumer is going to win, and the consumer doesn't want to go to 5 locations.
No. And Howard, let's talk about the other side. Like, I want to give you an example of someone on the opposite end of, was it orthodontist with $1 million debt?
Yeah.
Is that right? Okay. So, you got him trying to follow this model of where you go out and buy all the land and build the giant building and all that. And you have the other side of it where you have some smart guys, less debt. They've been working in corporate dentistry for a while, and they see the other angle, which is you have lots and lots of docs who are more than happy to sublease space to you, because they've got a facility that's sitting empty a couple of days a week. So you have the other side of it where you can get in really cheap to a subleasing situation and go after your big cases. So that's the other side of it for some of these people that want to be smart, that are younger. You go after the angle of, I'm going to have a super low overhead and I'm going to go after a highly profitable case. So then you're not taking on that huge debt of owning the facility or building a facility, et cetera.
And I just want to also tell you about one thing. When I'm talking to you as a dentist, I think you're Luke Skywalker. I'm not Luke Skywalker. If you're listening to me, you're Luke Skywalker. I'm the old Yoda guy who's trying to give you some advice so that you can clear your path. And that's what you got on Dental Town, where on Facebook and Twitter, if you post something that I don't like if you went to my Facebook page and posted I'm short, fat, and bald, I would delete you. I'm just kidding, I wouldn't. But when I go into Dental Town and I search for big case marketing with Dr. James McAnally, I find 5 pages. There's like 10 threads per page for 5 pages going back years. That's another thing I like about message board is that it's all archived. We got 250,000 dentists. They posted 5 million times. And some of these threads are just amazing, but you have so many amazing fans on Dental Town. I can't wait to go in there and post this podcast that I talked to the big guy himself. What?
Well, here's the thing, Howard. People either need to love you or they need to hate you. That's the reality. So I've got plenty of folks, sort of those battleship type personalities that are hanging on the profession that aren't changing their mindsets. Those types, they hate me, because I push the buttons that they don't want to have pushed. And then you have a whole other side of the profession where they're like, oh my God, I wish I could have met you, 10 years ago. So that's kind of the nature of this business.
Well, let's talk about that, because the owner.
No doubt, you have your own haters too, Howard. I'm sure.
I've never met anyone that didn't love me. I never have. But the bottom line is, let's talk about that, because the person who owns Facebook, Mark Zuckerberg, his dad's a dentist. Ed Zuckerberg comes on the show once a year to tell you everything you need to know about Facebook and dentistry. And but it's so obvious across Facebook, Twitter, LinkedIn, Pinterest, Dental Town that 1% of the people do the majority of all the content creation, and then 9% engage, like they might reply to something you post with LOL or I disagree, I agree. But 90% across all social media platforms since MySpace, everyone's a looker. And if you don't believe me, open up your Facebook page. The average person has 140 people on Facebook. Go open up your friends and just start scrolling down to the first 10. When you scroll down the first 10, probably 9 of them have not posted this year. I mean, they don't post. So when they started to come out with statistics, well, call 901 and we'll bill you $1 if you vote yes, and dial 902 if you vote no. And it didn't take the statisticians more than a few years to realize that every single one of them was statistically invalid, because you just had the crazy outliers voting and you had no idea what the silent majority is. So when you're on social media and you say something like James McAnally, well, of course you're just going to have standard deviation 2 and 3 to the right and standard deviation 2 to 3 on the left. You're not going to have, and after you get done reading the thread, you're going to have no idea what 90% of all the dentists in the United States and Canada, Australia, New Zealand, UK actually think about that. By the way, we just went over 5,000 dentists on Dental Town from the UK. And I want to tell you a little trend about the UK. When I got out of school 30 years ago, everyone thought the sky was falling and everybody had to work for the NIH. And every year they would just lower the fees and lower the fees and lower the fees. And the dentists literally had to go bankrupt to where they couldn't do the dentistry that they morally, ethically wanted to do in the time and fees. So they almost had to go bankrupt to leave the system. And now there's 5,000 independent dentists in the UK who have given the finger to socialized dentistry. And that's why it scares me about socialized medicine, because I don't know anything about all the other medical specialties, but I know a hell of a lot about dentistry. And when I go to those socialized medicine countries for dentistry, like in London and Paris and Tokyo, which is 3 of the greatest civilizations of all time, the socialized dentistry only gives you $100 for a molar root canal. And everyone knows in those very high overhead cities of Paris, London, that it would probably take $600 to break even. So what do those doctors do? They don't even offer a molar root canal. They pull the tooth because implants aren't covered. And they say, well, I'm not going to do a molar root canal for $100. I'm going to place an implant out of network for $1,500 and put a $1,000 crown on there. That scares the crap out of me. When you start doing things you don't like to do for money, that's usually going to lead to burnout. And burnout can be not pretty. It can end in substance abuse, depression, divorce, suicide. And so that's what I love the most about implants and orthodontics, is that Invisalign and an implant is at a network from here to Kathmandu. And then you go to Malaysia. Yep. Like I lectured in Malaysia and Vietnam and Cambodia, and these dentists were saying, well, the government Medicaid, I completely lose. It costs me about 120% to do all the cleanings, exams, and fillings for the government plan. But I harvest out of my patient base, to place 1 implant fee for service and 1 Invisalign case. And as long as I'm placing 1 implant and 1 Invisalign case a week, they're the top 5% income in their society. So, and then I'm
Howard, I'll speak specifically to your clients in the UK, and when I say UK, we mean England. England and Scotland. The opportunity there is like what it was here in the US 30 years ago. Like when we go into the UK market, and this is the thing, our advertising work, as long as we're in English, actually, I'll back that up. Anytime we've converted our advertising into other languages, it's always worked. So that's the beautiful thing about the planet, is you can always convert advertising to other cultures and language and you still get response. It's a little easier when we go into English-speaking countries because we're already ready to roll. But in the UK, when we launch our advertising campaigns that we use in the US, our response rate is 300% higher.
When you go where?
3 times the response when we're in the UK. So the response rate is 3 times what we get in the US for the same amount of money. So that's just an indication of how far back they are with catching up with these full arch cases. So if you're trained in I believe what do they call this in the UK when you're anyway, there's another name you call it when you're certified to do implants. If you're in that category and you're not going after cases with advertising there, you're really way behind because the patients are searching big time. It may not be in central London, but if you're out in any of the other cities in the country that are still very massive in population, you're super busy if you're advertising. That's the bottom line. So anytime we've gone into that market, we're always like, oh my God, this is like when it used to be in the United States. We're really fortunate.
And what about Australia? I've gone to Australia every 5 years for 30 years lecturing down under. What are your thoughts on Australia? We have, we're huge. We got about 5,000 dentists in Australia, another 5 in the UK, and I think 1,000 or 1,500 out of New Zealand. What's it like down under?
Each market, it doesn't have as much room for big players because the population of Australia is less than Canada. So, you have even fewer people to sell to. So that's, if there's any downside to Australia, it's lack of population. But in every market, there's 1 or 2 big players that do the most cases. So that's the reality there as well.
My brother lives in Australia, and I don't ever like talking about religion, sex, politics, or violence, but one of the biggest economic crazy things I've lived through is you ask any single American, well, what made America the greatest, richest, most powerful country on earth? And they say, well, for 500 years, people from all around the world came here. They voted with their feet. And the people that leave another country and come all the way to here, they're more ambitious. They got a big idea. 1 in 4 start their own business. And I'm like, yeah, exactly. Every PhD winning Nobel Prize economist agrees. So are you ready to open up Ellis Island? And they go, no, I want to build a wall. In Australia, once you're over 50, like my brother was telling me years ago, he's like, Howard, you got to move with me to Australia. I'm like, dude, I got 4 boys and 5 grandkids that live in America, so I'm sure as hell not going to another continent. But you can't even get in after 50 without paying serious bucks and signing away your rights to their healthcare system. You're not going to move down there at 55 and get free healthcare system. But no. Australia, it's so tough. It's so tough when you love your dentist, you love your people, you love your tribe, you love your country, and you sit down and you try to explain to them that the smartest thing to do would open back up Ellis Island. And when did Ellis Island get closed down? During the Bolshevik Revolution. And one interesting thing about that is you'll look at all these historical revolutions, they didn't take place in one country. The labor movement, the Bolshevik Revolution, that was all around the world. Just like right now politically, most countries have gone to the right. And it's not just the United States, it's Brazil, it's whatever. But trying to get these people to realize, I know it doesn't sound right, but you got to open back up Ellis Island. And we've been growing, our economy has been expanding 2.5% since I've graduated from college in 1980. And you could get that back to the days of 5, 6, 7, maybe even 8% if you open back up Ellis Island. But there's no chance that's going to happen. So I'm just wasting money in the wind.
Yeah, I know, Howard. And I'll pipe in here. I have, when I have a newer, what I call a newer American as a client, someone that's, maybe first generation after the parents are here, they are more willing to work harder than most of my clients whose families have been here, for generations. It's a different mindset.
Oh,
hands down.
Oh, absolutely. When you, Only 1% of the 7.5 billion Earthlings live in a country they weren't born in. Nobody wants to leave their country. And if you want to leave your country and go to another country, you've got a big idea. And when you come here, I mean, like, look at Dental Town. Look at the cover of every woman who's been on the cover of a magazine. They were born in Russia, Croatia, whatever, and they came over here, and now they got an office with 10, 15, 20 employees doing several million a year. And I mean, and you want to not let that person in? And the dentists in Australia are like, well, but she's got a dental degree. We don't want to let anyone in with a dental degree. And I'm like, dude, the people that come here, only 1 in 2,000 or 3,000 are going to be a dentist. But anyway, it's you're not going to change someone's mind in macroeconomics. You know why?
No.
Because in your economic mindset, if you have all these beliefs that got in there without any science or logic, no science or logic is going to get out of your mind. When stuff comes in, because that's what your cousin Eddie told you, and that's what your grandpa believes, well, you can't get out of your head. So we talked about marketing. And then one last thing I always want to say to my millennials, they're so infatuated with social media advertising because they're always on Facebook and Google and all that stuff like that. But these people that need implants, everyone that can show me the data, direct mail is always the number one thing. And what they're showing me, direct mail is about 1 out of 100. So if you want to do one case this week, well, then mail out 100. And if you're saying you need 15 incoming calls for one pays, then you need to mail out 1,500 pieces. When I got out of school, most dentists did not advertising. Did not. About 15 years out of school, the average dentist was doing about 3% of collections in advertising. And now every office I know that's in the $2 to $4 million collection range is spending 7% of their money on marketing.
Yep.
You agree? Disagree?
I agree. It's, in fact, if you look at, most of the time the dentists don't understand when they're, let's say, a fully committed insurance practice, they're paying, 15, 20% of their budget for the advertising to get those patients, which the advertising is being in the plan, so that discount you make on your fees, that's your advertising cost. But if someone's going after full arch cases or specialty services like full fee orthodontics, you're going to be at 7 to 12, 15%. That's just the reality of it. But on the other side of that, there's a huge amount of profit. So it makes sense for the business to be at that level. Now, where people get sort of screwed up is if they try to do a lot of advertising and they're going after an insurance patient. Well, that doesn't make any sense because you're already paying the fee to get that patient. So you don't want to put more advertising dollars on top of what you've already paid.
So I also, over the years, not only do I associate you with big case marketing, but you also were Dental Trust. Is that still a thing?
Sales training, we really focus on why do patients trust you more than other dentists. And there's a whole lot of contact points when someone comes into practice where you can either elevate trust or destroy it. And that gets back to really basic good administration of a practice. And obviously reviews are a big part of trust, and yet how many dentists have 100 reviews? And that's kind of the bare minimum now if you want the public to really find you and think you're trustworthy.
And what is that called? Social, what do they call that? Social online
credit,
social
proof.
Social proof. Yeah, and it's also it's also more effective with women than men. I mean, like none of the guys I know that I hang out with, I've never seen anybody with my own eyes use Yelp or anything like that. I mean, we're gonna go to a bar or restaurant or whatever, we just go check it out. But women more than men, they're gonna look at the reviews, and it's part of social trust. So online reviews, and it's the same thing when they don't have online reviews. Everybody I know that's crushing it with online reviews, they just create a culture in their office where they ask their patients for online reviews. And if you don't like selling, what you need to do is know when to intercept. Like when someone sits there and says, "Oh my God, this is awesome," you just like hold your heart and get verklempt to say, "Oh my God, I wish I was." Instead of hearing you say that, I wish I was reading you say that on Facebook. Can you post that on Facebook? And they pull out their smartphone right there in the operatory, go right to their deal. They check in, and then they say, I mean, you can do that. You can get one of those every day, every other day.
Every day. And there's there are several technologies now that we use one with our client base because I think these reviews are so important for everyone selling. is that literally you grease the wheels between the review site and the patient's phone. Essentially you send the invitation to their phone, they're in the chair, they write the review right then. And these are the practices that they're past the 100 review point. And they, once you're sort of past that, you generate patients just from those reviews.
Yeah, and so everyone's doing it. I had to get and I'm not even making this up, I had to get a colonoscopy, and they sent me one of those. They texted me about one online review, and I just thought there for a minute, like, I don't really know if I want to online review a colonoscopy. I think I'm just going to pass on that. Is there anything, James, that I didn't talk about that you wish we did?
I guess one of the other aspects is like, okay, anyone who's involved in implants and wants to get serious about it, you should also be having a conversation about going after those Medicare dollars, because that's a big deal these days. And outside of that, I've never seen dental sales for implants as good as it is right now. I mean, it really is going gangbusters. So people need to stop thinking that the sky is falling, because these cases are out there and a lot of them are being done. And I guess the last part, Howard, just to say thank you for everything you've been doing all these years.
I love it.
You made it easier for guys like me to stand up and say it like it is.
I think the luckiest thing about me is I've never worked a day in my life. I work with my dad, who owned 9 Sonic drive-ins, and 5 in Wichita, 1 in Kearney, Nebraska, Childress, Texas, Abilene, Kansas, Louisville, Kentucky, and riding around learning business, marketing, demographics, leadership. And then, but my next door neighbor, Kenny Anderson, shout out to Kenny, who's still practicing after 50 years. I would go to work with my dad, and he'd make a hot dog and onion rings. And I go work with Kenny, and he'd take an x-ray of this tooth and do a root canal, and had his own lab man making a full, oh my God, it was love at first sight. And I love doing what I'm doing. I've never worked a day in my life. But his name is Dr. James R. McAnally, DDS, FAGD, FICOI, Fellowship of the Mission Institute. Go to Big Case Marketing. And my gosh, just quit telling yourself. I don't care if you lie to me. Don't lie to yourself. Just quit telling yourself you hate sales, you hate marketing, you hate staff, just start telling yourself you love it, and you will love it. And there's, I think, James, what you did, I think you're the leader in this field, and I think you're crushing it. Thank you so much for coming on the show.
Yeah, thanks a lot, Howard.